welcome to the Euvie podcast, specializing in gynecological education. Thank you for listening. Today's topic will be the ovaries. Now, the ovaries are the primary reproductive organs of the female reproductive system. They are two small oval-shaped organs that are located on the pelvic side wall on each side of the uterus. They are about the size of an almond. The ovaries are attached to the uterus via the ovarian ligaments, and the ovaries are attached to the fallopian tubes via the fimbriae, which are a special type of tissue at the ends of the fallopian tubes. The fimbriae help in sweeping the egg into the fallopian tubes from the surface of the ovary, usually around the middle of the menstrual cycle. Moving on to the structure of the ovaries. The outermost layer of the ovary provides a smooth covering for the ovary itself. This is known as the germinal epithelium. The layer underneath the germinal epithelium is known as the tunica albuginea. This thick, fibrous layer protects the delicate underlying tissues of the ovary. Far inside the tunica albuginea is the ovarian cortex. The ovarian cortex contains follicles and their connective tissues. Each follicle contains oocytes that may mature to become ovum or eggs during a woman's reproductive years. And lastly, we come to the innermost layer of the ovaries. This layer is known as the ovarian medulla. This layer contains most of the vascular tissue of the ovary that supports the other layers. All the layers of the ovaries work together for one reason: to produce eggs. The ovaries produce ova, otherwise known as eggs, which are the female reproductive cells. When a female baby is born, her ovaries already contain all of the eggs she will ever need. This number is estimated to be approximately 2 million eggs at birth. Each egg is contained within a group of cells called the follicle. This group of cells will support the egg until it reaches maturity. However, their numbers steadily diminish as the child grows, and by the time a girl reaches puberty, only about 4,000 eggs will remain in her ovaries. Out of these eggs, only about 400 to 500 will reach maturity and be released into the fallopian tubes for the purpose of fertilization. At the start of every menstrual cycle, about 10 to 12 eggs and their respective follicles begin to grow in size under the influence of the follicle-stimulating hormone FSH that is produced by the pituitary gland. In every cycle, among the 10 to 12 eggs, one follicle will grow faster than the others. This follicle is known as the dominant follicle. Once the dominant follicle is chosen, the other eggs become dormant and wait for their next turn in the successive cycles. It is this arrangement that makes sure that only one egg and not more than one is released in one cycle. After the dominant follicle reaches maturity, it breaks open and releases an egg into the fallopian tubes in a process known as ovulation. Ovulation typically occurs midway in a woman's menstrual cycle. In this manner, one egg is released every month until all the eggs in the ovaries are exhausted. When there are no more eggs remaining within the ovary, the function of the ovary starts diminishing, and in a year or two later, the woman reaches menopause. In addition to producing eggs, the ovaries also release several different hormones that help to regulate the female reproductive system. Estrogen and progesterone are two of the main hormones that the ovaries produce. There are 3 types of estrogen: estradiol, esterone, and estriol. Estrogen is a hormone that is essential for the development of the primary and secondary sexual characteristics in a female. Production of these hormones starts when the ovary follows the trigger of the follicle-stimulating hormone from the pituitary gland around the age of 10. These hormones are responsible for the growth of hair in the armpits and the genital area, progressive increase of the size of the breasts, and fat distribution in the legs and hips, thereby forming the feminine body contour. Estradiol plays a key role in breast development and fat distribution in the breasts. These above-mentioned characteristics are called secondary sexual characteristics. Estrogen also causes an increase in the size of the uterus and ovaries, the primary sexual organs, at around the same time of the menstrual cycle, so that it becomes ready for the menstrual cycles to start. And this typically occurs when a girl reaches puberty around the age of 10, when the follicle-stimulating hormone is produced. Progesterone is another hormone produced by the ovary that causes the uterine lining to thicken during ovulation in preparation for pregnancy. The progesterone is secreted by the corpus luteum, which is a temporary gland created within the ovary after ovulation. Progesterone also prepares the breasts for lactation. It is released as the egg travels down the fallopian tube. The corpus luteum is a temporary gland because it will disappear if a woman is not pregnant or does not become pregnant in that cycle, obviously. Progesterone is also a very crucial hormone in the human body. But this is a very quick summary of the role that progesterone plays. Minor hormones secreted by the ovaries include relaxin, which is produced during pregnancy and childbirth in order to relax the cervix and vagina, and inhibin, which is a hormone that inhibits the follicle-stimulating hormone produced by the pituitary gland. The ovaries produce many more hormones. However, this is just a quick summary of a few of the more vital ones. For more information on any of the hormones mentioned in this podcast, please view the Encyclopedia Britannica's entries on estrogen, progesterone, or any other hormone. In addition to producing hormones and eggs, the ovaries are delicate organs that are susceptible to different types of diseases. One of these diseases are ovarian cysts. A cyst is a fluid-filled sac, and ovarian cysts are extremely common. The majority of cysts are harmless, in fact, and ovarian cysts can often affect women of childbearing age, although they can affect women of all ages. Ovarian cysts are often a normal part of menstruation and typically will go away on their own. Cysts can range in size from a pea to a grapefruit, sometimes even larger. Any cyst that is larger than 8 centimeters in diameter may need to be surgically removed, for a cyst that size may disrupt the blood flow to the ovaries. Though many ovarian cysts are harmless, some can be pathological. If you are experiencing pain in the abdomen, lower back, or thighs, talk to your doctor. Other symptoms of ovarian cysts include, but are not limited to, infertility, irregular periods, increased hair growth, bloating, and fatigue. Sometimes, instead of a single cyst, some may have multiple 10 to 15 small cysts in both ovaries. These are called polycystic ovaries. Polycystic, meaning many cysts, is the first word in the condition named polycystic ovary syndrome. And this is a condition in which the follicles in the ovary mature to a particular stage and then stop growing without releasing an egg. According to the National Institutes of Health, about 5 to 10% of women will experience polycystic ovary syndrome. And common symptoms include infrequent or scanty periods, infertility, increased hair growth on the face and body, etc. If you are experiencing any of these symptoms, please talk to your doctor. Menopause is another aspect of life that affects the ovaries. Estrogen levels fall rapidly at or around menopause. Some women experience a smooth transition into menopause, while for other women, the transition is stormy. Both of these are perfectly normal and natural. These women may experience a lack of sleep, mood swings, irritability, excessive sweating, hot flashes, and flushing of the face, etc. If these symptoms are disturbing, you need to consult your physician. Osteoporosis is another condition that can be aggravated or worsened or even brought on by malfunctioning ovaries. This is because the ovaries produce estrogen, which is essential to producing bone. During bone production, there are two types of cells: osteoblasts, which produce bone, and osteoclasts, which absorb it. Estrogen typically helps the osteoblasts. Therefore, when estrogen levels drop, usually during menopause, the osteoblasts have a hard time keeping up with the osteoclasts. Because of this, more bone is being absorbed than being produced, and bones get weaker. As a result, estrogen replacement therapy can often help combat osteoporosis. Another condition that is related to the ovaries is premature ovarian failure, or POF, which is when the ovaries stop functioning before the age of 40. Often, the first sign of POF is a missed period. After that, most symptoms resemble those of menopause, such as hot flashes, mood swings, night sweats, and irritability. POF results in decreased fertility, so most women cannot get pregnant naturally. Although fertility treatments and donor eggs may help some women conceive, there is no treatment that will return full ovarian function. However, it is recommended that women with POF take vitamins and calcium supplements until the age of 50. Another, more serious disease of the ovaries is ovarian cancer. Ovarian cancer is a rare but very serious disease. Most of the symptoms of ovarian cancer are common and are usually brushed off as minor inconveniences. However, you should talk to your doctor about anything abnormal or out of the ordinary. Symptoms of ovarian cancer include vague abdominal pain, indigestion, abnormal uterine bleeding, and bloating. If you notice any of these symptoms, please talk to your doctor, for the key to fighting any form of cancer is early detection. Overall, the ovaries play a very important part not only in the female reproductive system, but in the endocrine system as well. However, the ovaries are very delicate organs, and if you notice anything out of the ordinary, please talk to your doctor. Please remember that this podcast is not a substitute for professional medical advice and is to be used for education only. If you notice anything abnormal or out of the ordinary, please consult a medical professional. Thank you for listening to the Euvie podcast. We hope to see you next time.